Governor Andy Beshear and the state's top health official are echoing growing criticism aimed at the CDC over recent changes to COVID-19 testing guidelines. One advises that some people who don't have any symptoms do not have to be tested, even if they've been in close contact with an infected person. LEX 18's Mike Valenti has more.
In the spirit of constructive criticism, Dr. Stephen Stack first touched on what he appreciated about the revisions to the guidance, that it draws attention to people in high-risk populations, like nursing homes. But then he pointed out the part that has garnered the most controversy, a change to the CDC website that says if you've been exposed to the virus but don't have symptoms, you don't necessarily need a test, unless you're a vulnerable individual or your doctor or local health officials recommend one. Dr. Stack worries people may use this as an excuse not to get tested.
We know that as many as 40% of people may be walking around infected and spreading the symptoms, but not, or the infection, but not having any symptoms or signs.
Normally reluctant to criticize the White House, Governor Beshear slammed the changes.
That's reckless. It contradicts everything that we know and have learned about this virus. It is inexplicable. And in Kentucky, we're going to still continue to do the right thing. I believe the CDC is going to change that new guidance. It doesn't make any sense at all.
CNN reported Wednesday that a federal health official said the CDC was pressured from the top down to change the guidance. HHS Assistant Secretary Brett Giroir denied there was political interference and told reporters the guidance has been updated to reflect current evidence and best public health practices. Are you aware of any studies or evidence that may support this change or what he may be referring to?
Yeah, it's a good question. So I'm not aware of any new data or specific studies or evidence that would suggest that doing fewer tests makes a difference. The only thing that I can think of to make sense of it again is, are we strapped for resources?
Dr. ERIN Cooper has treated patients with coronavirus at her practice in Lexington. She says the new guidelines are a major shift that caught her by surprise.
As I've been digesting the changes and making sense of it all, the thing I think to keep in mind is that we know that transmission can occur in asymptomatic and pre-symptomatic people.
So Dr. Cooper agrees with Dr. Stack and Governor Beshear, who say people who have been in close contact with an infected person should still get tested. And she hopes if the CDC guidance is not changed, she can at least get some more clarification. In Frankfort, Mike Valenti, LEX 18 News.